So I was asked to present on assessment tools. And so naturally I focused on mental health. And although there's many other varieties that are out there, I'm by all means not an expert on mental health assessment tools. But we have used them quite a bit, in having worked in the hospital system, working in a intensive outpatient system, as well as working in private practice, and also working here at our center at Northeast Ohio Medical University with students. And I think one of the core issues that becomes a challenge for everyone is, this day and age, is finding something that is economical and quick, that can be used, and in the interests of saving finances. And that was something that when I had worked at the hospital system, they were trying to convert from using like Beck depression inventories, which are very good assessment tools, but trying to find something that would be economical. So my focus today is really drawn from trying to identify assessments that are, I'm kind of getting ahead of myself, that involve quick and easy assessments that are validated and also free. So let's see, why is this not cooperating? All right, I'm gonna stop share and move to a different screen so I can get to the proper slideshow here. Okay, should be the same thing that you saw before. Is that correct, everybody? Okay, but it's not advancing. Oh, here we go. Okay. So the general considerations that I'm presenting today are just on general screening tools for mental health, but also giving you access to self-screening websites. Okay, I'm not going to be discussing a lot about the pieces and parts of the assessment tools, but I'm going to give you really great resources to be able to connect to those things. So this is more of a goodie bag type of presentation today, and putting these things on your bookmarks and or files so that you have access to them. At least that's how I would look at it if I was in the position of like, ooh, these are good things. I'm going to put this in here. So some general considerations when we look at mental health assessments is, again, in this day and age, we're looking at public settings that have a lot of workload, so and poor financial compensation and limited time. So we often find clinicians are finding their time like, I have to hurry up and get some kind of baseline assessment done. It'd be nice if I could have go through it very quickly so it is documented, but it's not going to cost us a lot of money. It's not going to take a forever lot of time. And there's actually a great research article that I found that really picks through a lot of these. So again, we're looking at things that are free and accessible to you. They're time limited, so they're very short and quick that you can do, and they're validated. So when we do these things, when you use assessments, you really want to come from a basis that is evidence-based practice, which means that these things have been researched, they've been shown to be helpful, and time again are consistent across the board. So what I'm sharing with you today are things that have been researched, validated, and put into practice. Now, evidence-based practice is not only kind of looking at those research tools and how they've worked, but also that clinicians have put them into practice and found them to be helpful, so that there's a comprehensive way in which we're looking at this. One of the recommendations is to look at broader assessment tools and then you narrow down. So for example, there's a broader assessment tool for mental health called the Patient Stress Questionnaire. And essentially it really involves like maybe 4 different other assessments, one of which is the GAD-7, which is an anxiety assessment, PHQ-9, which tends to be a depression screening, the audit, which is a alcohol-based substance use disorder assessment. And also we're looking at, I think it also does some PTSD in there as well. So that's just one example of a broader base. When you get those hits and then you see that there's something that's more specific, then you're going to want to kind of narrow the focus and get into, like, let's say you get a hit on the audit, which is a very basic substance use disorder, like screen, and you see there might be something there, then you want to get something that's going to be just a little bit more specific and narrow it down and kind of look into, is it drug use, is it alcohol, and then from there. Also, you want to consider who is completing the screening tool. Is it the clinician asking questions? Is it a parent responding on behalf of their child? Is it the child, or is it a caregiver? You're getting multiple different perspectives in that case. So you need to take that into consideration. Who is the one filling out the assessment screener? Generally speaking, they have found that it is better to go with an OR rule. The OR rule is if a youth and a parent, or a parent fills out an assessment, that they should target any areas that come up as being symptomatic. Okay, versus what used to be considered an AND rule is, which only considers symptoms if both the youth and the parent or the caregiver signed up for it. So they're saying everything matters. We want to look at one or the other. If it's symptomatic on the youth or the parents, then we're going to pay attention to anything that comes up. We also want to consider cultural considerations. So based on the community that you're serving, has this assessment been validated with different racial and cultural groups? And so that's an important consideration, because if it doesn't come up, for example, this is more of a, a kind of environmental thing for our institution being a medical institution. We have students that are well-versed in already what symptoms of depression are, anxiety symptoms, and what have you. We use the GAD-7 and the PHQ-9 to screen for anxiety and depression, so that we have something, at least they filled it out. Invariably, they're smart cookies, right? They don't want the institution to know oftentimes that they're exhibiting anxiety, or maybe they're not really realizing it, but they'll just go through and minimize. We suspect based on their self-report that they go through the list and it looks like a very minimal score for anxiety. But when we talk with them on a clinical scale in a broad range, it could be moderate to severe. So you have to take, who your group is. That's not the best example of an ethnic or racial group, but it just speaks to that you need to know who your audience is and whether that assessment is appropriate for them, and whether you need to take it a little bit further to make sure that you're getting a comprehensive view on the situation. The other thing is that rating scales do not automatically equal a diagnostic scale. So rating scales should not be used to make a diagnosis. Some of these are double up that I'm presenting to you today. And that's what, if I were a clinician, I'd be targeting as much as I could, but it doesn't equal an automatic diagnosis. And also there's some things that you can find that some of these that I'm presenting today, you can find a link you could print it out, or there are some digital options. Oftentimes I find that the digital options, unless there's some other ones that are out there on the government website, which there are a few that you can do online, and it'll tell you, but for the most part, you have to pay for those. But I'll show you which ones belong to what. So the screening tools in actuality. So this is the actual research article that I pulled. At this point, it was such a, one of those really great like charts that you find. You're like, this is everything that I want it to be and more. Although it is dated 2015, so we do have to take that into consideration. There was some really great information, because they had gone through the process to really comb through all of these assessments, these mental health assessments, and really identify, hey, is this just a screening tool? Is it a diagnostic tool? Is it validated? What populations is it best for? So rather than recreating the wheel, I'm sharing this with you. So hopefully, don't worry. We're giving you this information. So I know it is micro-sized, so don't worry. But if you actually get this article, you can just control link and go to a lot of these websites. Some of these links were actually not put in accurately, and they were a little bit, they were one thing off, like it used a capital S instead of a small s. I did go through some of these just to make sure that the links were working. And granted, again, it's like a 5-year-old article, but these were really pointing to some really great websites to start with. But what I also did as I went through this is kind of put my own little touch on things that we use in our center that I have found not only that we use here, but when I was working in the hospital system in an IOP-based system that we were using at the hospital. So, I mean, obviously I haven't gone through all of these, but for example, the GAD-7 is one in going through that, the PHQ-9. But as you look at this chart, you can see here's the screening and if it's appropriate for those types of screenings and that symptomatology, and whether it also has the double hit with diagnostic opportunities and then any treatment monitoring and evaluation. So what that means is that you can take that assessment and then follow up with it, like maybe midpoint to see if there's any changes in that and whether it supports that process. So for example, you can see the reason why I like the GAD-7 is it is good for screening. It is good for getting that diagnostic criterion to help support an anxiety-based diagnosis. And I can use it again to get a baseline to see whether my patient's symptoms are decreasing. Same with the PHQ-9. So this chart offers adult instruments. And so I knew Patricia would likely be here today and some other pediatric-based clinicians. So I knew I'd be in trouble if I didn't put youth and child assessments in this as well. So, but under this, you see adult instruments for anxiety, depression, eating disorders, and mania. And overall mental health, and there you can see that PHQ, the patient health questionnaire, which is just a I can't even get the word, but it's a conglomerate of the other assessment tools like the PHQ-9 and GAD-7, like I mentioned earlier, personality disorders, suicidality, and trauma. So we have looked into the Columbia Suicide Severity Rating Scale. That is pretty prevalent in the world, of the mental health world that we work in, and also the post-traumatic stress disorder. I know that when I did work in the hospital system, there was a trauma center associated with that, and they did use the PCLC. So moving on, there's some, here are the youth-based instruments. Is very similar to what I just laid out for the adults. That one I would be very careful for, because as you look at the columns, there's only a few that get those hits, like I said, that you can get a diagnosis and screening and really get that full evaluation. So what the article really illustrates is like the, I think that the RCADs and the SCAS, those things really point those things out. Oh, and I just accidentally clicked myself into the next page. So again, you see this material. Okay. So what I wanted to kind of take you to now is some helpful websites, and I'm going to try to do an additional screen share on this so that you can see what things that we've been, what I've navigated through, and kind of really getting these goodies of the websites that not only provide these instruments and make them available to you, but there are websites that actually continuously evaluate the instruments to make sure that they're valid and keeping them up to date. And so one of those is the National Institute of Health has created a program called PROMISE, not to be confused with our buddy LeBron James and his I Promise School. But let me see if I can share my screen and get to the PROMISE. There we go. Can everybody, wait, you probably can't see that just yet. This is it. Yes. Okay. You should be seeing something that says health measures. Is that correct? At the top? Okay. So this is, I don't know. Oh, that's coming from, yes. Okay, so it used to be, I had this really great go-to place. I think it was on the NIH, the National Institute of Health website, that it would give me all the assessments for depression and anxiety and everything, and they have stripped it out. It's no longer there. It doesn't exist. Luckily, I downloaded everything at the time that it was there. And I think they streamlined it because it has redirected me to this promise, they call it assessment thing. And so I think the reason why they just didn't want it out there, they wanted to have some control over that, not just anybody or everybody was getting access to these assessments, that we have clinicians who are going through the process to educate themselves, to go through the manual, to know how to score it, and to know how to interpret it, and have them available. So some kind of level of, quality control on the process so that it's helpful. So this is one of those websites where you can get a lot of the assessments, and it's just taking some time to go through and access it. Then also, interestingly enough, the National Cancer Institute warehouses a lot of these assessment tools as well. So if you go through their website, you will see that they have a lot of areas that you can get the measures from and kind of go from there and just kind of go right down the line, alcohol use, and navigate it. Now, the one that I thought was really interesting was the psychiatry website. And this is the American Psychiatric Association. And actually, non-psychiatrists can access this without having to be part of the association for this particular link. And they are in the online assessment measures and kind of looking at this. And they're constantly updating the standardized assessment tools. So it's a really great website to go to if you want the latest, greatest. So, like I mentioned, this article that was written that that the other charts were coming from, there might be some new updates to that, because I think since that point we've had the DSM-5, it's no longer the DSM-4, so we have to pay attention to the new diagnostic criterion. The other thing that I wanted to share with you is one of the screening tools that was one that I really liked is pulled from the, let me see if I can find it here. Okay, here it goes. And it took a little bit of searching. They did include in the article and the chart, the screening tools for PTSD. However, it really didn't kind of get to the site. Again, what used to be pretty like out there, and there's the link, click and download. Things have gotten a little embedded. And again, my suspicion is because they're trying to really be good stewards of the information that they're putting out there and making sure that just not everybody's just downloading these things and assessing themselves, like my daughter would for herself. So, true story. But anyway, I tried to give you the links that would get you to the direct shot, because look at all the stuff that you have to go through to get to this. But it's hidden underneath all this. And I don't know why they made it so hard, but that's just something I wanted to give you so that you could see. And what's interesting about the post-traumatic stress is there's a couple of varieties, different layers of it. Some of it might include a life events checklist, which is really important when you take a look at trauma. For example, I've had many patients come in and yes, I've experienced trauma. On the screener, they would say, yes, I've had trauma in the last X amount of weeks. And for a med student, a trauma is apparently getting something less than a B. And so that's, we have to look at the frame of reference and what their life experience is about. So that's where something like an addendum, like the life events checklist, we're looking at, okay, were you in an automobile accident? Was there, harm to self? Were you in a violent, and just kind of going through that so that it's really guiding the patient to know that these are the things we're talking about. And so that's where that patient interview comes into place. Okay. There's really great screening tools referenced on the National Institute for Drug Use. Is that the one? Hold on a second. No. but I didn't include the drug use one, but there is really great substance use disordered ones that are really helpful, that look at not only for adults, but youth. So these things, again, you can't, it's not one size fits all. The PHQ-9 may seemingly look like it's something you could give to a teenager, but you really have to be cautious that it has been validated to go with, you know, an adolescent versus an adult. So this is another really great website. This is coming from the Mental Health America, where they do, you know, kind of dive in there and go into the depression test. Can you see as I click through, are you seeing the things as I navigate through it? I just want to make sure the screen's not freezing. So what you should see right before me is the depression test and the questions that are lining up right now. It should say little interest or pleasure in doing things. Does that work? Okay. So, you know, here they have it already online. You don't even have to download it. But a lot of the resources that I'm giving you in the links, you could do a paper download on these things. So for example, I have the PHQ, the PHQ screeners has a lot of these tools there where you do the PHQ-9, the GAD-7, and there are other instruments that they have available, as you can see here. And there's longer versions. There's a PHQ-15, so that typically means the amount of questions that they're asking in this case. Okay. The other thing that I wanted to share is looking through general screening tools, and this is that the mental health screener is one of them, the Mental Health America that I was showing you. You can see a lot of those really great tools, and there's one even in Spanish, as you can see, PTSD. So that is a really great one-stop shop. And if you want to have your patients go do that. And then last but not least, there are some, this is called the IBH Partners. They have screening tools listed there and the links that go directly to them and what they're supposed to be directly related to. So these are all just really great go-to items. Like this document's just a PDF and it's like 230 pages. So like that is like something I would like hurry up and download before whatever mysterious thing is happening with these screening tools online. Download it, get it in there before people get wise to the fact. But I think more and more is becoming prevalent where they're actually sharing and opening this up. And lastly, mental health screening assessment tools. So the things that I've clicked on today, and I'm gonna, okay, I'm gonna new share and go back to my presentation here. Okay. All right. So again, in my presentation today, I've been going through just giving you the live version of what these links look like, but you will have them accessible to you so you can kind of review them yourself. Try to put them in some kind of comprehensive togetherness so that you can look at it really quick. I have some teen and adolescent screening tools. Again, like I mentioned, the PHQ-9, you don't want to do the adult version, but there is one that's been modified. The American Academy of Pediatrics creates a screening chart that's helpful for teenagers as well, which is really great. And then there's online assessments. So I gave you the Mental Health America. That's something that you could do, actively have somebody do online, and it probably gives the person the score. SAMHSA is another great site. They have some of those. And then I just like to include suicide prevention screeners that are in there. And then like for us, we use, if you're in the college world, there's a program called U-Lifeline. It's free, and students could go on there and anonymously and confidentially go through the screeners, and it'll tell you, you really need to see a mental health professional. And then there's the Suicide Safety mobile app. I do have to say that I'm seeing more and more of those screeners kind of disappearing and more of the resources being available. And so I'm wondering if there's some kind of liability issue with sites having screeners and then not necessarily diverting people to that help. So that's just my theory. I don't know if that's actually a legitimate thought, but it's just something that I've noticed just since I've been accessing. So, when we go to the very end and kind of we look at this, do assessments really give us the full story? This is an old book that I had to read when I was in my PhD program. And it was really talking about like, do we, is psychology and psychotherapy, a bunch of bunk? Is it built on this or that? And the fact of the matter is, you can argue that assessment tools aren't going to be helpful, that you can just have that intuitive interview and what have you. And I guess my argument is, my experience and my clinical experience is, we need to put it all together. We need to use those best scientific practices and then really identify what the patient's values are, as well as what their clinical experience is. It's just putting that whole piece together. So like I said, in that example, working with medical students, their frame of reference and what trauma is very different than when I was working in the hospital in intensive outpatient and what trauma was, or in the trauma center, what trauma was. And so it's really important to really get a baseline understanding, what depression is. Even there's loose terms that, every people use these days. I'm depressed. Well, is it clinical depression, or is it I'm just depressed, or I'm anxious? We use those so very easily. And so that's just taking that into consideration. So that is it from me.